you achieve the movement you want. I could have her stay where she is. I could definitely put a bolster underneath, the ankle so it's a little higher so I have more play. Or in this case, I'll have you slide down if you don't mind. And a little bit more. So you want to really free up, you want to have a lot of freedom of the ankle so you can work on them. And again, I'll ask them, they don't have to, but I'll say, you want to bend this leg for your back?
Sure.
So making sure she's comfortable. And then what I'm going to do first, good. So I'm going to work on distraction first. So open pack position of the ankle is about 10 degrees of plantar flexion. Same thing for the subtalar, right? Midway between. So I'm going to hold on. I'm going to just from here, stabilize and just distract. Just distract the joint. That's all I'm going to do. Okay? So I'm trying to keep the knee from moving, to really purely isolate the distraction. And again, same thing. I'm just trying to see, gauge how much pain she has, how nervous she is, build that patient physical therapist relationship.
What is he distracting? The talus on.
Yeah.
The whole structure.
So then again,
The anatomy matters.
Yep. So then from there, after I do that, so if I want to achieve dorsiflexion, I'm going to push dorsally, posteriorly, dorsal glide. So from here, so I could stand up. I don't mind staying up. You could sit too. Just want to make sure the vector of the force is going down. I can even put this table down, but I'm fine. And then just from here, I'm going to do a grade 2. You also want to work on explaining. So I know you're doing a lot of the mobs, but then start practicing on your verbiage. What do you want to say to your patient? I'm going to, so because you're having a lot of pain, I'm going to just do gentle, movement into the joint. Please let me know if anything hurts you, okay?
Yes.
So this is going to help hopefully reduce what you're feeling. So then grade 2. I'm stabilizing here as I'm pushing down. I can stay on up 2 and do it. And I'm dropping my body. See how I'm like kind of rocking or bending? So I'm not trying to come all from here. Okay, so that's to achieve dorsiflexion. The other thing now is plantar flexion. So from here, I'm in front of the patient. I'm going to, and she'll also be on her stomach and doing this, like what Dr. Highland said. You could change them if you can do it that way if you want. I'm fine doing it this way. So 10 degrees of plantar flexion, give or take. You can measure it if anything, and then just come up. I mean, I am using my arm, I'm going to be honest, a little bit more doing it this way. So if she was on her stomach, I'll show her the other way. So go on your stomach. This is a little bit better biomechanically. I'd rather see it this way. I'll just use this one. So from here, just push down. So it's a ventral glide. So grade 4. Just dropping into it, I oscillate. Just like that. Okay? You can lie on your back again, please. So that's for plantar flexion. What I tend to do too, what you want to do actually too, I want to mention, is that since the talus the talus has a little bit of a buttress in the back where the calcaneus is, you really want to distract first and then apply, because then you're really clearing this, you're really getting through that joint a little bit more, because they say it has a little buttress back here that stops. So they say distract, then do the glide. Just want to let you guys know that. Okay, the other thing is inversion, eversion. So lateral glide is going to help with inversion, and vice versa. Medial glide is going to help with eversion. So hands are going to be 2 trains passing, right? That's how I always say, 2 trains passing. So elbows out, stabilize, and then just apply the glide for inversion. I'm doing a lateral glide to achieve inversion. And then you just do the grade you want. Okay?
Can you do a 4?
Sure.
I just. Just a 4.
So again, my elbows, making sure, good body mechanics.
Okay.
Some people do this, back and forth, a little bit, not letting go too much, but I just know how to oscillate like that. Okay? And the other way, same thing. So I'm pushing with this hand, so I'm not moving this, it's just indirectly. Okay? That. When it comes to, so I want to talk to you about too. So this is all for the ankle, and that's it. But getting a little more in detail, just to be, sometimes you'll be having trouble with getting. How come I'm doing the glides, I'm doing the mobilizations, I'm not getting. They're still lacking the range of motion. I'm not going to do too much mobilization movement, but I will show you a few things that Dr. Heil and I were talking about. Is the distal fibula and the proximal fibula. That could also help achieve the plantar flexion or dorsiflexion. So concave on convex at the fibula is going to be here. So you just palpate for the fibula head right here. So then what you're going to do is when she dorsiflexes, so lift up your foot, please. I'm going to go with it. Or you can go back down. Or I could just do the mobilization without anything. Just mobbing this. Anterior. I'm pushing anteriorly. And then the other way, I get right on top and then push posteriorly. But with a mobilization movement, I can do, so for example, if I'm going to push posteriorly, plantar flexion, or push down the foot, it's in patient language, and come back up, push down, come back up. So I'm working the proximal fibula to see if this is stuck, and maybe that's what's stopping her from having the dorsiflexion, plantar flexion. Okay, same thing down over here. I could assist. So push down your foot. I could help the distal fibula too. Maybe that's a reason why it's not moving. Same thing with dorsiflexion, go. And I'm just helping try to release, so I could do it this way. Try to release, helping it along, distracting up, right? J-swoop, distracting up, okay? Just showing you different things. One more thing, I know it's on the sheet. Same thing, I know with distal, radial ulnar, proximal, and distal with the mobs that you did to help with supination. Don't forget also the middle of it probably could also need some mobilizing, all right? Middle of the forearm. I know we just did the upper body last time. I just wanted to mention that to you. Same thing for here. What I tend to do too is for the tibia, I'll hold on to the fibula, and then the tibia, I'll work on back and forth to work on loosening that interossi. Okay? The proximal end. There's really no grading for this, maybe. Yeah. I'll just go back and I just kind of like just work it.
Feels good.
And then I'll go in the middle, back and forth, and I'm using my fingers, but and I'm also using the eminence, the eminence. I'm going back and forth. Okay, and I'm also working the distal, and that will help with improving range, mobility, maybe some pain that they're having deep within, right? Because all the inflammation, whatever had went on with that patient. Okay. Any questions so far? Because I want to show the raise next.
Oh, you're gonna do my toe?
Well, unless someone else wants to come. Dr. Highland, anything to add?
Your toes want them.
Good. All right, so the first and second toe are huge for push-off, right, for the gait. So you'll see medial lateral whipping. What happened?
It's her toes.
You're filming it already, okay. This little piggy. So, we do circumduction gait patterns. So what you want to do is, if you have hallux rigidus, what you do is now, in the direction you're going into is the direction that you're trying to achieve. So this is concave on convex. So with the big toe, I'm going to go as high up as I can, palpate, right? So I feel it right there, metatarsal, proximal. And then I'm just going to distract, right? Always distract first for the most part. And then this is stabilizing. This is not moving. And I'm applying, you do your grades with this. So grade 1, grade 2, grade 3, all the way to end range and back off a little bit. Is that okay?
Yeah.
Always checking in. In grade 4, and oscillate. And that's to achieve extension. And then flexion would be the other way. Okay, so I'm just pushing down. And then I'll do a little passive range of motion too. Same thing for the other toes. I know it's not on the sheet, but you also could look at the cuneiforms, right? Palpate. Come in here, and then just, this is like PA mode, so I don't think there's really any grades for this. You can, but just trying to loosen up that whole, those cuneiforms up, okay? Right over here. And shift to the other one, and go so forth. All right, now the subtalar, it's good, this helps with inversion and eversion. All right, so it's the same concept as convex on concave. So if I want to achieve inversion, I'm going to go laterally. And then if I want to achieve eversion, I'm going to go medially. So in this one, though, you could just go, you could also go back and forth, to be honest. So distracting up, or go back and forth. But I'm just letting you know what you're trying to achieve because it's a convex on concave, okay? And another thing you can do too is line your side. So let gravity help. What you can do too is hold on, check in with them, and then they say this works pretty well. Roll it back and forth, loosen it up. It's another way to play around with the subtalar and loosening it up a little bit, okay? And I'm distracting a little bit and doing it. Alrighty?
Massage. It's not PT.